I think we will start. We have, I know we have some people that are online, so we had to make sure we waited until 22 before we started. But I'm Judy Little, if you can't see. This is me. Okay. And the masks, of course. Okay, today's topic is on medicine, and we have 3 people from our congregation. If you're not familiar with them, I think as soon as you see their faces, you'll go, oh, yes, I know them. But they're going to be sharing. And last week it was the kickoff, and we did education. And it was a wonderful panel. And I think there were people had lots of questions because they brought up things that you didn't hear in the press. And unless you were a teacher yourself, or you knew a teacher close to you, you wouldn't know of the stress that they went through. So I'm sure that we're going to learn some new things today from these ladies. It's on Facebook, I believe, the education one. So if you missed that, you can go back and pick it up on the church's Facebook. Today's also will be put on Facebook, but it's being streamed live right now on the church's website. So, anyway, we had some people request that if you have questions after the panel has done their storytelling or whatever, that we amplify the voices because they couldn't make sense of some of the answers because they didn't hear the questions. So I have an extra microphone here. So at the end, when we have our question time, if you'll just raise your hand, I will run quickly to you and you can ask the question. Otherwise, they have to try and keep track and restate it. So let's begin with a word of prayer. Dear Lord, today we pray for your peace. We pray that the peace of God, which transcends all understanding, will guard the hearts and minds of all who are here today and for those listening at home. We ask for courage. We remember that God did not give us a spirit of fear, but of power and love and a sound mind. Please grant these caregivers your spirit of courage. May they be blessed with wisdom and grace. In his name, amen. One thing, when we, after the speakers have spoken and we've had our time to have questions, then we're going to break off into some smaller groups. And I think there's enough of the adult ed team here that we can lead, but I've coerced Claire to be one because we're down 3. And anyway, so we'll have some questions and answers. And she's going to have some little, or he will have some little pieces of paper for responses. We do appreciate if you make just a quick response, or if you have any suggestions for the adult ed team, we would take that too. But the pastors are serious about praying for your needs. And if you don't feel like sharing things in a small group, you can jot it down and it'll be anonymous. We'll put it in there and the pastors will pray for you. So I was trying to look for some scriptures that I thought would be appropriate for caregivers. And there really wasn't any one thing that just filled the bill. But you know, Luke was a physician. He was the only Gentile that actually did writing in the Bible, and he was one of the apostles. I thought that was kind of interesting. But usually the priests were the ones that were the physicians way back in time. But you had to go to the temple, and they would check to see if you were clean or give advice. But they did have physicians too, because Luke was one. There was also a lot of rules about how to stay healthy. What you could eat, what clean animals there were. You know, you could eat this, but not that. There were rules about if you had any sores on you, you had to stay isolated. So there was a lot of health concerns and a lot of healing going on in the Bible, but nothing specifically that I could find. That hymn that Linda played at the beginning, you probably recognize the melody. Our hymnal is really, really wonderful. If you ever have a chance to look through it, but on page 796, there is that hymn that she played, and there are 2 verses that I thought were so appropriate. I'm going to read verses 1 and 3. If you want to read along, you can, or you can just listen. 796. We come to you for healing, Lord, of body, mind, and soul, and pray that by your Spirit's touch, we may again be whole. You touch us through physicians' skills, through nurses' gifts of care, and through the love of faithful friends who lift our lives in prayer. I just thought that spoke very well to our topic for today. So I'm going to invite right now our 3 panelists, and I had invited Judy Robs to come too, but she had a death in the family, but she called me and said I would still come and talk. And I said, oh, that would be wonderful. She was going to share how to properly fit an N95 mask, because she's done that for hospitals and whatnot. So at the end of our time together, after we're done sharing, Judy will be around if you would like to have her coach you a little bit on how to fit masks properly so that you get the best use of them. So we have Dr. Mary Nettleman. Ta-da! She is an elder at the church, and she is a recently retired dean of the South Dakota Medical School. And Pam Koepsell, and she is, I've known her for years as a nurse in the NICU and pediatric care. She's going to give her spiel, what she normally does when she's talking to people. And you need to know that through this whole pandemic, she also earned her physician's assistant degree. Nurse practitioner. Well, okay. Anyway, a very difficult thing to do while working full-time during the stress of COVID. And she's still alive and walking. Sherese Kelliher is a nurse at Sanford and also the VA. And these ladies are all members of our church. So it doesn't make any difference how we start. They have about 10 minutes apiece. So is that mic on? Let's try it.
Now it is, yeah, okay.
Okay.
So I get 10 minutes to speak with you about experiences with COVID. I am a physician. My specialty is infectious diseases. So you know how it goes. People say pandemic and everybody goes, oh no, and all the rest of the people in ID, ID is short for infectious disease. We all go, cool. So this, in January when this was coming, I could see it was not going to work out well. It's related to something called Sars, and of course I knew the history of Sars, which if you don't know it, that was a coronavirus that was much worse than the one we have right now even. Killed many, was much more fatal, but was stopped at the Canadian border by good old public health measures. And so that's probably one of the greatest miracles in medicine of my lifetime, because that was not going to end well for a lot of people. And there was no, at that time, vaccine, and there was no treatment, but by isolating people and making sure that the cases were stamped out, it was gotten rid of. So I was the dean of the medical school, and medical school, first of all, the medical school takes almost exclusively from the state of South Dakota, and these are South Dakotans, and so you have to learn book learning, you have lectures and that sort of thing, but it's also has a huge amount of apprenticeship, where if you go into the hospital, you'll notice there's a medical student with the physician, and over here, and so you have to learn by taking care of people, and it's a highly supervised and highly structured clinical experience, and that's what really that's what these students want. They want to take care of patients, and they have to. You can't learn to be a doctor or a nurse if you are not taking care of people. So when the pandemic hit, the medical students, if you remember the PPE, the masks and everything, they were in short supply. They were in very short supply, along with toilet paper. But the fact that we couldn't get protective equipment for our health workers meant that somebody had to leave the hospital, and it was the students who were forced to leave clinical training, because it was for everybody's benefit that they go on. But during that time, which was at least 2 or 3 months, the students were not allowed in the hospitals to take care of patients, and they were devastated. I mean, they went into medicine because they wanted to take care of people, they wanted to do good, and here was a great opportunity to do good, and they were forced not only out of their training, but out of the opportunity to help. So we had rearranged our schedules so that all their lectures were front-loaded, so that they didn't actually lose time or have to graduate late. Thank goodness we were allowed back in when we were, and we owe a debt of gratitude to the hospitals that arranged all that. But they weren't there to listen to lectures and work on books and things like that. They had to do that, but they were ready to get out there, and so they did other things. They did blood drives. They collected masks and N95s and other things from the community to give to healthcare workers. They educated people about COVID. They went in and helped drive people back and forth to appointments. And they spoke in various venues on coronavirus. And we didn't tell them to do any of this. And it goes on and on and on and on. And they developed a leadership group that they were doing this with. They really responded at a time of great stress for them. Remember, they're paying a fair amount of money to go to medical school, and they're worried they're not going to graduate, they're not going to be able to move on to the next stage of training, but they really, really responded. And actually, we had some of the first cases in the state. We had medical students who had a winter break and had gone to Vietnam and came back sick and had COVID. One of the first cases in the whole state was probably end of January, maybe deep into February, maybe February, I should say. But it was documented that it was a COVID case. So everybody was concerned. Now, the first year and a half of medical school is much more lecture-based, or much more learning and trying to figure out what's going on. And we've always recorded those lectures, and we've always live streamed them. And one of the complaints of the physicians is, I have a class of 72 people, and 3 might show up. The rest are all at home, or they'll listen to it online, and it's very annoying to the presenter who can't see their class. But the student would sit there and they'd go through part of the lecture, and then they'd go read, and then they might back up the lecture, and that's the way they learned, right? And so it was good for them. Well, come the pandemic, and we were open, right? University of South Dakota was having classes once we were fully back in classes, and it was socially distanced and masks and everything. Everybody showed up. I mean, we had a class of 72 people. Normally, they just wanted to have that human interaction. And the other thing, and I'll end here, is there's a lot that I've gone through. I'm not practicing infectious diseases now, but I had a lot of friends and relatives who would call me when they got sick. I myself have had to, leave my husband at the door, and just like anybody else, I was not allowed in when he had to be admitted. And I really feel for them. And I know now that of the people in the hospital right now, for example, 90% are unvaccinated, 95% of those in the ICU are unvaccinated, and 97% of those in intensive care are unvaccinated in this community. But I really want to leave us with the idea that unvaccinated does not mean bad people, right? I'm hugely a fan of vaccines. What a massive blessing this has been. But many of those people would go to the wall for you, and they might have fallen down a rabbit hole. They might have thought that they wouldn't get that sick. These are really good people. These are not people who should be blamed for the disease. In medicine, we don't blame people for their diseases. That's an old-fashioned thing, right? You got disease because you must have been a sinner. We don't do that anymore. So I want to leave us with the idea that these are good people, and we're going to get through this.
So I'm Pam Koepsell. I work with children, and so I have a whole different perspective on the pandemic than what Dr. Nettleman and Sherese will talk about, because the pandemic really and the coronavirus really didn't impact children like it does the adult world. So until now that we're starting to see this second surge kind of coming through, we're starting to see more of that impact some of our kids. Coronavirus has been around forever, and we see it in kids. Our respiratory panels that we draw on kids that come in with respiratory illnesses, you can see a coronavirus panel, and it tells us that. But it's not the variant of 19. So of course that really concerned parents when they saw coronavirus and that concern for that. But also with my position, I work in palliative care, and for those of you who know what palliative care is, in the adult world, it's really synonymously used along with end of life and hospice. In children, It's really working with children that have complex medical diagnoses. I work with perinatal palliative care where children that are unborn have been diagnosed with a fetal or lethal anomaly. So we work with families with birth plans for that. And then neonatal and then pediatrics up to into the 20s. So a lot of our part is working with symptom managements with these children with complex medical diagnoses. So we do get involved with a number of children, a number of families, and we really partner with our families, with them, and to really help them understand what is going on with their child and what their fears are, what their concerns are, and to really walk the journey with them. So I think back during this pandemic when, of course, the hospital allowed no visitors to come in, so the family was all by themselves. So that also included pediatrics. However, we were very fortunate because we know the importance of that family connection and the need for a child to have a parent with them. So we were very fortunate while the adult population, and Sherese will talk about that a little bit, that that patient was all by themselves in the adult world. In pediatrics, we were fortunate to have a parent to spend time with their child, which needed to happen. Developmentally, that was very, very important for these kids, not to be separated from their parents because they don't know us by any means. And they were scared. They didn't know what to think. And of course, depending on the ages of these kids, they'd hear on the media of what this illness was doing, and they didn't have necessarily the understanding of what that meant. They were hearing people dying left and right. And so it was hard. It was hard to communicate that. And fortunately, I work with a team of child life specialists who are key. They are instrumental in helping diffuse some of the concerns, the anxieties these kids may have. So one of the situations that myself and my physician got involved with is we had a trauma patient that happened to come in. She was 15, and any trauma patient who's 15 or older goes to the adult population. The adult surgeons take care of that. And that's just been how it has been for years. We do have pediatric surgeons, and I kind of question that, and I don't think that policy has just really been looked at since we've now got pediatric surgeons. So this case was over in the adult world, and we got called because the child was not going to survive. And so we got involved, and we went over and met with the family, and of course that was very limiting their visitations because of the protocols of the pandemic. And of course, we knew what we could do to help families come in to be with their child and spend time with them. And in this situation, because she was in the adult population in an adult ICU, they limited family coming in. So we were blessed to be able to navigate this system and work with the hospital and our pediatric administration to allow this child to be transferred over to the pediatric ICU. And then they allowed extended family to come in and spend time with this child before she died. That family was forever grateful to be given that opportunity. So again, working in children's and with babies and families, even in our perinatal world, when these moms were going to be delivering their child or their baby, we were able to work with administration and to really thoroughly evaluate and assess the visitors coming in, because we knew how important family really was and is, and we felt badly that we could do that when the adult population couldn't do that. But we were grateful to have been given that luxury of having that, do that. Our staff were incredible. I also sit in on some of the orientation with nurses, and I remember sitting in with this group. We were talking about end of life, and these nurses were just burnt out. They were totally exhausted. And I just asked them one time what was one of their biggest concern and they said that they had patients that were dying, numerous patients that would die, and those patients would be in those patient rooms because there was no place in the morgue for them to take that patient, and then there was no families around. So it was devastating to hear that. And I can't imagine the pain and the emotions that these families had knowing that they could not be with their loved one. And I know our staff did a tremendous job holding hands and walking with these individuals.
So I'm Sherese Kelliher, and I've been at Sanford for about 26 years. I've worked and I also work at the VA as an intermittent employee. So what Pam is speaking to, I've lived that. Closer? There we are, sorry. So we, the unit that I work on at Sanford is a surgical renal transplant floor. With the pandemic, we knew that it was a possibility that our small 19-bed unit that I am a charge nurse of would maybe perhaps become a COVID, extensive as the numbers grew. That thought really scared me because I am a leader and I know my type of patients, but on October 31st, when all this was happening, I was fortunately the charge nurse of my floor, and I had to move 17 patients off of my floor on one shift through my director's assistance, finding the right place for some of the COVID, retirees that were stable. In my mind thinking, they're not stable, but I have to move them off, knowing that this was what I was needing to do. So turned around and moved some of my staff on other floors. We moved them to Peds Overflow on 3900 at Sanford, moved what I, in my mind, thought was the best place for these patients. And we became a COVID unit. We turned around in one day. And so with my director and another nurse, we opened up a COVID unit. We had the supplies, and I ended up going actually down to ER because there just weren't enough hands and people. ER was busy, and so I'm like, well, I'll take the first patient, and went down and got report. And by the way, Judy Rops fit me for my do you remember that, Judy? So small world, sharing that I just wanted to remember and point you out. But it was a very scary time for me, knowing and learning about this virus and hearing from some of the people that were already taking care of these patients. And my skill set was not to take care of people with BiPAPs and heated high flows. And I would say that being a nurse for 26 years, that my critical thinking skills are in tuned and in check. And I knew that this was going to be a whole another world for me, but I had to hold it together for my team and for the people that I was working with. And watching the patients, and like Pam pointed out, there could be no visitors. So we were their family. We had to be with these people and, teach them and be with them 24/7. And I think, as a nurse, you're with these people for 12 hours, and I could start the beginning of my shift and thinking, oh, this patient is stable. And by the middle of the shift, oh, their oxygen needs are higher. And making that phone call to the physician saying, you need to come see this patient, I think they're making changes and we're headed to ICU, but there were no ICU beds. So we had to manage these patients in the best capacity, working with physicians and the respiratory therapists who, for me, were a wealth of knowledge, and we were just right in it, and there was just no looking back. So I reflect, and leaving shifts thinking, I wonder if that patient is going to make it. And there were some patients that we ended up being with and holding their hand, and they were a DNR, so we knew that we were going to be there when that patient passed away, and we were going to have to make that phone call to the family member. And that really was a very tough time. I get a little emotional about it because I felt like preparing for this, I would have gotten through this, but through God's strength, I was able to get through. But it's been an emotional time still, obviously. Being God's hands, their eyes, and just trying to really reach out to the family members, and we were there when this patient passed away, and letting them know that they weren't alone was reassurance to them. And I'm thankful for the vaccination. So being on the other side, I decided I needed to give back. And so I decided to work in the COVID vaccination clinic as well, because this gave me some strength knowing that I could help in other ways. And speaking with Mary, I actually did teach for SDSU as well. So taught in the middle of the pandemic, got halfway through clinicals, and then they said, nope, you're going to be teaching online. So kind of seeing through all the aspects as a teacher and as a nurse. And then I ended up getting COVID myself through the pandemic, and hoping that my team would be making it through. Luckily, I didn't have to be hospitalized, and I was strong enough to get through that. But it really opened my eyes that there is this virus, and it really has brought me closer to God, and I can't do His work unless He's there with me. I think that's it.
Can I just add something?
Yes, I was going to ask you, Pam, if you would speak to the telehealth
Yeah,
a little bit,
that's-
because
yeah.
that's one thing she mentioned to me.
So as I, they were talking to me. They asked me when I was asked to be a part of this panel about the positives that have come out of the pandemic. And due to the limitations of people being able to access healthcare, sometimes getting to and from, the beauty of having telehealth and telemedicine was a tremendous offer to allow those patients to see their patients, to work with, and to be seen. Not the same, but by any means, because you don't have that physical eyes on them. For us, part of our symptom management skills and even meeting with families who had a pregnancy with a lethal anomaly, it was our way to be able to connect with them and get to know this family, what their concerns were, what their wishes would be for their child that would maybe only live for minutes to hours. But it was a way that we were able to connect. And part of what two of my physicians offer clinical hypnosis, and it's a tool to help children and adults, self-hypnosis, to work through symptoms such as pain, anxiety, sleep. And that continues to be a very good avenue for one of our physicians that is able to meet with these families without seeing them in person.
Is this microphone on the questions? Hello? Oh, it is. Okay, so if you have a question that you
Or should I use that one?
it's on.
Now it's on, okay. So South Dakota, if you, obviously we're a small state, so, 2,000 missing people, we miss those people. If you look at it per capita, we did not fare as well. There was, for many weeks and even months, we were in the top 10 in the country for deaths and for cases. We have recently fallen out of the top 10 for that. But we did not do as well as some other states did. So we have recently slipped down. North Dakota is hung out in the top 10 for a long, long time. And it's a contagious virus. You know, my husband's seriously immunocompromised. July, he got Delta. If it hadn't been for some of the newer treatments that we have, he would have been in the intensive care unit. And so we have things we can do now. Even with Delta, our mortality rate is not what we saw at the very beginning of the pandemic, for which we should be forever grateful. But we still are seeing people die from this virus.
The questions? Right here. Okay, this one's not picking up? Okay. Okay, we'll just have a little delay there. Here you go, Claire.
Pam mentioned the children seeing media reports. I just wondered how all of you thought the media covered this, the pandemic, the virus, the new treatments coming out, the weird experimental treatments that some people tried. Just what did you think of media coverage overall?
You know, I can't really direct that personally, but I really think there's so much uncertainties as to what was going on. And I think there were so many ideas out there, and Dr. Nettleman probably can reflect a little bit on this too, that none of us really knew what to expect, because we really didn't. I mean, I listened to Sherese saying one day they didn't have a COVID unit, the next day they did. And I think we went to work every day not knowing what to expect, what we were expected as staff, and where we would be placing our patients as well. So I think, you know, it's a difficult call to know what media to be listening to. I guess we were always relying on our CDC to really tell us what was most important, but I don't know if Dr. Nettleman has anything to add to this or not.
Well, we live in an information age, right? You can find any answer you want, and you almost can find any answer you want. The media was both very helpful and unhelpful, but that's the way things go. I mean, we tend to polarize things, and it is still a polarizing time, but it was particularly polarizing when the pandemic first came. The thing you need to know about science is that science changes its mind. It changes its mind when it gets data. That's what science does. That's what makes it science. You don't take a stand and stick to it, like, don't wear a mask, do wear a mask, don't wear a mask, do wear a mask. Science gives you what it thinks is its best answer at the time. And so there's a lot, in the media, they get rewarded for viewership. And so if they say something crazy like today the sky was orange, or that today the sky was purple, they're going to get some viewers. People are going to want to know what that was. So they had different agendas, so it was crazy. It's the age we live in. Information and disinformation are just out there in such a time you wouldn't even be able to filter it if you tried.
Into groups. Okay, I think what we'll do right now is, who's on the ed team that we have? I know Jack and Linda and Sally and me. So if you'll stand up so people can identify you, and then we're going to kind of disperse here, try to evenly place yourself with one of those groups. And Claire, I co-opted her. Yeah, she can probably stay right here if some people want to just turn and face reflect. And one of the things I would like to know from you is, how can we that are not in medical care, how can we best support you? Because I know a lot of times we were feeling that you were in pain and stressed, but what can we do to help? And so if you want to think about that and share that with some of the groups, if you want to just rove around or park at one of the groups and answer some questions, we would really like to know that. Other than prayer, I mean, prayer is good, but if there's something else we can do. So let's disperse. And then, if you'll